Welcome to today's edition, a series of Talk to Dr. Tiwa Mental Health Series. I am your host. I'm Dr. Tiwa Oshinfisan. I am a practicing psychiatrist and a physician capacity strategist. I help professionals, especially physicians, medical students, residents, in protecting the most valuable assets, themselves, while doing what they love. So the key thing is that they don't lose themselves while practicing medicine. Welcome. I have a an amazing speaker with me today that I'm excited to speak with, to chat with, to discuss the weight women carry. So we'll be talking everything about medicine, faith, motherhood, career, purpose, just wait. We're going to learn from her what she's done. We're going to discuss, and I'm excited. If you are a woman, welcome, you're in the right room. If you know another woman that should be in this, that should be here, that should listen, quickly send this link, get them in here, and let's discuss, let's chat together. Adeola Folorunso, it's a pleasure to have you here. Thanks for joining me today.
Yeah, thank you, Dr. Ashifensa. Thank you so much for this opportunity to be here today.
A pleasure. So, without wasting time, I'm going to read Adeola's bio. Adeola Dorcas Folorunso is a global health leader, humanitarian innovator, and advocate for equity and culturally responsive care. She began her career in Nigeria as a registered nurse in 2010, driven by commitment to advancing health systems and improving outcomes for underserved populations. She earned a Bachelor of Science in Nursing with distinction from the University of Saskatchewan, a Master of Health Administration with distinction from the University of Virginia, and a Master's in International Public Health from Liverpool John Moores University, the UK, through a UNICAF scholarship, where her research focused on autism spectrum disorder among Nigerian children aged 2 to 17, addressing critical gaps in awareness, diagnosis, and care. She holds an MBA from Universidad Isabel through a scholarship from the European Business School of Barcelona. Adeola is the founder of MetaMental and co-founder of Thrive, a digital platform designed to screen, detect, connect, and educate women globally on postpartum depression. In 2023, she convened the Beyond Baby Blue Summit, engaging over 250 participants across Nigeria, the United Kingdom, and United States to expand access to screening, education, and care. Our work spans neurodiversity, maternal mental health, and large scale community outreach, including programs supporting children with autism spectrum disorders in Nigeria, leading the Mission Feed 100 Children initiative in Uganda to address malnutrition, and co leading a 3-day community and school based initiative in Ibadan, Nigeria, addressing brain health, addiction, and substance abuse, made possible through the 2026 Ibro Dana Foundation Brain Awareness Grant. She was invited as a speaker by the Johns Hopkins Center for Global Health in Maryland, presenting on equity and leadership, women of diverse racial backgrounds, shaping the future of global health. She's a recipient of Mercury's in America for her outstanding contributions to mental global health. Adeola holds an honorary doctorate in humanities and leadership, and she serves as the United Nations Ambassador for Peace and is a certified health executive in Canada, fellow of the Royal Society for Public Health, and fellow of the Academy of Public Health. She's currently in medical school, navigating training alongside motherhood, NGO leadership, and global advocacy. She lives what she speaks. Welcome, Adeola. So great to have you.
Thank you. Thank you so much.
Yes, yes, yes. With that, could you? So I've started with a lot. Could you, you wear so many hats. Could you tell us a little bit more? I mean, you're a nurse, you're a medical student, you're an NGO founder, you're a mother, you're an advocate, even soon to be a doctor. When someone asks you who you are, where do you even start?
Thank you so much for that question. When people ask me that question, I start with purpose. So everything is tied to purpose. My role as an advocate, my role as a mom, my role as a medical student, my role as a founder of an NGO organization, all tied to focus. And that focus is just a priority, and I do not keep my eyes on that. So all those roles are tied together just because life needs to be impacted through healthcare, through research, through even being a student. So it's not about the title, but it's about the lives that need to be achieved through keeping my eyes on those focus.
Wow. Love that already. So, from what you said, target, focus, purpose, keeping your eyes. Wow. So, for those that don't know you, we are here to talk about the weight women carry. Can women really have it all? Women, we have so many hats. So for you, with you keeping, how have you been able to balance what you focus on? Or do you focus on all of this at once? Or were you pursuing all of this? How were you able to plan? This is what I should do now, especially for maybe a young lady listening to us, or a woman that is like, oh my God, I'm a mom. I want to do this, or I want to be a doctor. I want to start my NGO. What do I do first? I have all these great ideas that I want to pursue. How were you able to plan or pick which hat to focus on? Or did you focus on all the hats at once?
Well, it would be very impossible to focus on the at once. You need to set priorities. And for me, while there's always a call to serve in different capacity, I do prioritize what is needed and I channel my energy to what needs to be done now, and other things can wait. You have to be sure of what you need to do at certain time. You cannot be everywhere at the same time, or even if you think you have the time luxury, right? All these things requires planning itself, and not just planning, quality planning. So you have to look at where the energy or what is needed right now. What is important, putting that priority in that order of ranking, and follow accordingly. So otherwise, if you're just here there all over the place, you're divided, you're thin out, and at the end of the day you are not in depth into one particular thing, right? So what has really helped me is ability to get mastery or take mastery of my time, right? So you cannot just come and say, Adeola, come do this for us, come do that for us, come do this for us. My priority and my focus, right, or on my purpose is remains as the priority. So you cannot. So sometimes so many things are being offered. All those things look good, but is that what I need right now? Absolutely not. So ability to know what to wait and what to move forward is very important.
Wow. Love it, love it, love it. I heard prioritization. I heard again focus. And you said it, you can't be all things to everybody at the same time. You're going to thin out. And so for those that don't know, May is the mental health awareness month. And the second week, May 6th through 11th or 12th, is specifically the maternal mental health awareness week in May. So the reason we're talking about this, and in America, is Mother's Day, the second Sunday of May, is always the second Sunday in May. So this is why we're here talking about mothers, talking about motherhood, talking about women, because we need to talk about ourselves. We do a lot, we wear so many hats, and it's good to discuss what to do, how to do it, and going forward, what you may need. So if there's a woman that needs to listen to us live, don't forget, share that link, let her know let her join us as we learn and as we discuss with Adeola today. So, the name Matamento is so intentional. It's not a common name. What does it mean, and what inspired you, and what do you tell us for I know about it, and it's a great foundation. So for those that don't know, tell us about what the goals, the gap it bridges, and why the name.
Well, you see, the name was not something I founded myself. I'm just privileged to be the founder. So I'm just a vessel that that Matamenta just have to exist. It was under the inspiration. In fact, when the name came, I was even in my cardiology block. So it has nothing to do with mental health. When, but before then, um, 2022, 2023, a lot of my friends were coming, asking questions, referring friends to me. I'm not even a psychiatrist, right? But I'm a registered nurse. They kept referring friends to me about counseling, and I keep hearing similar thing, about postpartum depression, stuff like that, something around mental health. And you know what? Because it was just too much within that 2020, 2023, I said, I think people are in a bottle, they are stuck. They need to, there's a channel, they need a channel to, ventilate what that means. And we know when it comes to ventilation, that's even the beginning of healing itself, right? So I
Yes.
said, oh, okay, what about I do a summit? It was my first time. I've never planned something, such a thing like that before. But to do a summit, it has to have a name. Who is bringing it together? you know and so 2023 was really powerful when it comes to that discussion around postpartum depression or mental health generally. So I said, okay, what name am I going to give this? But I put it aside. I kept studying for my cardio block, and then matamental just came up. So it came
Wow.
up. So those are two powerful words coming together:
Correct.
maternal and mental health. But the question is mental just serving women? No, absolutely not.
Okay.
We've served men, we've served children, because the word maternal, when you use anything female, it has to do with productivity,
Mhm.
progress, expansion,
Mm.
care, nurturing, right?
Mm.
So don't be carried away by the name just maternal. The maternal itself is looking out to carry, everyone as long as a human being. And that's why our codes is, or our team is impacting life across the spectrum. That's the team
Mm. Mm.
maternal. So it all started from that, the need. There was a demand for that kind of conversation, but it has to go through a channel. But like I said, the name, it wasn't something I sat down to coin. It wasn't just me. I'm just,
Wow.
yeah.
That is impressive. It's such a unique name that, like you said, the first time I heard or so, I'm like, who, like, this is really good. And so it's good that you're even saying, though it may have started off addressing maternal needs, it's also now helping the other aspect of their lives, the children of that mother, the husband, the men, because whatever affects men and
Mhm.
children will eventually affect the women.
That's true.
So we're all so interconnected that really, while focusing on one, it would be good to also help the others, because that woman is not going to stay whole or
Yeah.
healthy if our husband is not doing well, if our children they're not doing well. So I like what you said, that even maternal means productivity,
Absolutely.
expansion,
Absolutely.
progress, enlargement, care. And that's remarkable. That's really profound. So well done. And it's impressive for I mean, just hearing you say it was a need. People started asking you questions, and you wanted to bring people together in the same room to discuss this. Very profound. So to women out there, I hope you're taking notes. If there's a need, if they're coming to ask you for questions, maybe you're the solution people are looking for, rather than always just pointing the finger. Maybe that person, if there's a gap, ding, 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 see if you have the capacity for it. Of course, we're going to talk about capacity and how you've handled this. So, you began your nursing career in Nigeria in 2010. Take us back to that version of you. What was she carrying? And what did she already know about what this work would cost her?
Well, for me, a very curious human being and very very curious, and not just only that, I'm a very compassionate person and also very ambitious, right? So I just know that going into nursing or any healthcare profession itself entails sacrifice, right? But what I do not know while I was going in is how to balance caring for people and also maintaining that balance of not losing myself in
Correct.
the course of caring for other people. But that came over time after a few years into practice. I mean, I've been practicing nursing for 16 years now. The way I started then is not, the way I will handle things now. Experience has come in on how to manage emotions, that I can care for people, but I don't have to break myself or break
Mm,
my back because I can't pour from an empty cup,
yeah.
So it is the ambition for sure, but try to balance, both caring for people and also not, breaking myself, but still looking out for myself was very key.
That's great. And of course, that leads me to the next question of why we're here, the topic. So we said the weight women carry. Could you share, some of the specific weight? Looking back, we said nursing, but the other things, is there any particular weight that comes to mind that, yeah, I mean, you've also mentioned you had to learn to also care for yourself while caring for others. But if you were to share any specific of a weight where, you've had to carry in healthcare or as a mother or as someone doing all of this while also in medical school right now. And I think that is the key thing where, I work with medical students, I work with residents, I work with doctors, and with medicine has evolved. It has changed over several generations. I have my dad is a doctor, and medicine at that time is completely different. I have relatives that are doctors, and you're just like it's changing, and that's one of the reasons I do this, where we need to medicine. It cannot just be all about medicine, where you sacrifice yourself and then you lose yourself in it. What how can we, maybe not balance is no longer the word I use integration. How do we integrate ourselves? Because you can't stop being a mom while you're a doctor. I can't stop being Tiwa while I'm here and who I am, and I bring all of me every time. So it's more so, my question to you is, as a healthcare executive that you are, with the experience you've had, public health, advocacy, policies, nursing, now in medical school, what can you share about certain weight that you've had to carry?
It's the weight of expectation,
Hmm.
right?
Hmm. Hmm.
Even we already have in the back of our mind that, I'm expected to, to do something as a professional. The weight of being, responsible and effective on my role as a mom, the role of being, showing that, being personal care, giving that effective motherhood presence, the role of advocacy, that expectation, societal role. So even if the society is not telling you that, there's a part of your brain that is informing you that people are watching, right? But but we have to be careful. We have to recognize that this is a human being behind everything. And so ability to say no to some things at certain time is very important. Knowing where to channel your energy. And if you're saying no at that particular time, it doesn't make you less of a leader. It doesn't make you less of being effective. It doesn't make you less of being a good mom. You know, you might be going through so many things, maybe at work, at a particular point in time, work is demanding so much, and you're a mom and all that. You know, the weight of you're supposed to perform all the
Hmm.
time. But look into your circles. Who are the people that are there for you that can step up at that moment? I've listened to a CEO before, a renowned CEO, I can't remember her name. And she was mentioning when our kids were supposed to get some things done in school. And it was the same time with the, a CEO expectation at national level where she needed to go to conference. The time we were clashing. And she had to look into her circle. who could stand up and help her and take those kids to, to school to help her at that moment. So because a lot of time women, we want to do everything, and that if we don't do everything, then we are less of who we, the society has called us to be. But don't forget that all these expectations are not biologic in origin, they are socially constructed.
Mm,
So we don't have to fall for that.
mm,
we
mm.
we should be able to, take ownership of what
Correct.
we want to focus on, at the detriment of, such that we're not affecting our mental health and well-being overall.
Correct. Correct. Wow. 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 Thanks for sharing that, the story of the CEO, and I like your honesty, your transparency, because being in medical field, most most doctors, it's almost like the requirements to be in the medical field or health field, healthcare field, is almost what we call type A personality. And
So,
type A personality is, you're always, you want to be perfect, you want to show up, you want, it's almost, there's I almost want to call it almost a God complex that comes with it. The need to be needed. You want to be needed, you want to be perfect, you want to be everything, you want, so there's already an unspoken
mhm,
pressure that you are trying to overcome or to handle. Then you add society to it. I mean, the societal one, a doctor should be this way, a medical student should be that way, a mother should be this way, an advocate should be this way, a wife should be this way, so a girl should be this way. So at the end of the day, it's almost like when a child is born, that child, if not careful, begins to live according to the pressure, of life. The girl gets married. When are you having kids? She
mhm,
has one. When are you having more? She has more. When are you having more? When are you raising them? When are you this? And then the ones that have work, how come you have a job? Shouldn't you be taking care of the kids? The one that decides to stay at home, why are you at home? Why are you not working? It's almost like there's always something, and it affects all women. It affects everyone. So I'm glad we're having this conversation, because what you just said is what really emphasizes. That's what highlights this. That we really need to talk about this, and how do we break free from expectation. So that may be my is it my next question, because you've highlighted all this pressure, expectation, and maybe before I get there, yeah, let's talk about that. In this environment, what are the suggestions you may have, or what are the practical tools, which you've shared a little bit of, where you prioritize? You ask yourself, you said with that CEO, is there somebody else that can go? Is there some, so what how can you delegate? So delegation may be what we need to highlight, because some women don't know how to delegate.
mhm.
It's me. If it's not me, it will not be done well. You don't delegate at home. They are the ones cleaning. They are the ones cooking. They are the ones doing everything, washing. They are the ones doing everything. And you're still, you still want to be productive. So share with us maybe a few tips of what you have done looking back, when, being a mom, you've been a wife, you've been the advocate, you've been all of this. Share with us other things we can, if that woman is listening to us, or a man. So a man may be listening to us. I'm like, let me listen for my wife, or let me
Okay.
listen for my future wife, or maybe a man is listening to us. I'm like, let me listen to my mom, that is always trying to do it all in the name of the society or the personal struggle. What tools would you share with us of what can help that woman listening to us?
As basic as keeping communication open is very important. When you have a spouse and you need to fulfill so many roles, and your presence demands so many things, you need to wear multiple caps. If you don't speak out that you need help, the man will assume, and our men are so wonderful. They're like, yeah, my wife got it. It's all covered. It's
You
she
got it.
can do it. Ah, why not? you know. So if
You
you
got
don't
it.
speak out, people just assume, and a lot of people are caught up in assumption syndrome, where people just believe she can do it. She's not complaining, right? But even speaking out, like I said, when people were coming to me, I knew that people were something were bottled,
I
like
was
emotions were
struggling.
bottled.
That's
There
true.
was then there was a need for an avenue, right? So communicating that with whoever you think can help you carry the weight. There are people called the burden bearers. You know, that's their role. They come along. I have moments in my second year of medical school. I remember so well 2 years ago, and I was like, Adeola, what are you even doing here? Like in the Yoruba, we would say like, "Talo rueshe," like what is it? What's your problem? Right? Like you feel, before I went to medical school, I was already working in the capacity of a director with the government in Canada. So what is your problem? What are you looking for? And I was able to reach out to somebody who happened to be a body bearer and said there was a reason you started. Keep that reason. Keep it, keep it, keep it. You know, burden bearers are not supposed to be there all the time, but the moment the pressure over what is about to overtake you, look out for those people. And the only way burden bearers they will be standing right in front of you, but if you don't talk, if you don't utilize them, everybody will think you have it all figured out, right? So, as basic as communication, say the way, because saying it does not mean you're weak. It doesn't
Thank
make
you.
sense of who you are. In
Thank you.
fact, it tells you that you understand and you acknowledge that there's a problem or there's a challenge, and you feel that at this point, okay, who can I bring in on board to be of help to me? I remember when I was finishing my first master's, and my mom, she was, we're back in Canada then, and then she was in England with my siblings. My siblings are based in England, and I was about finishing, and I was working as a director, and I had two kids. My kids were way younger at that time, three things contending. And then it was the time COVID was coming too. So I was preparing because that was the time leadership who were really tested. Time of
Mhm,
the COVID.
mhm,
Called in my mom. Mom, please fly in. Come over. I need your help.
mm,
So that she
mm,
could help me give my children the quality care that they deserve while I face, the societal expectation that I've been
mhm,
called to show people that you have not chosen the wrong person as a director at
mhm,
that point,
mhm,
right?
mhm,
So if I just kept everything to myself, that I'm a superwoman or Hebrew woman, you know, I'm
mhm.
just doing myself a disadvantage. Right.
Wow. Thank you. Thank you. That's profound. I really liked what you said about communicating. We need to speak up. One of the mantra or the hashtag I love to use four S's is speak up, seek help, support another, and spread the awareness. So I'm very big on those S's because, like you said, I think with COVID was really what helped to spread the awareness of mental health. I tell people like COVID wasn't the best, but it also highlighted gaps. I mean,
That's true.
suddenly people are addressing their mental health. I mean, sometimes it feels like it's overswung to the other side, but the fact that we're having this conversation is great because before then, people were keeping quiet about their mental health, people were suffering silently, but people are beginning to speak up now. There are several NGOs, there are several opportunities. So this is good. And like you said, I like the fact that you advocated for yourself. So one of the things that happens to women, women, we want to be there for everybody, but we don't know how to be there for ourselves. We don't know how to advocate, but meanwhile, we can advocate for everybody else. Okay. And I usually say a wise person, a wise woman, a wise person is that person that knows when it's time. And that's why I like what you said. It is wisdom to discern when you need help. And when you need help, you speak up. And not just speaking up, you don't stop until you receive that help. And in turn, you help other women, you help other people to do the same. That to me is wisdom. And I like what you said about reaching out is courage, reaching out is strength, reaching out is courage. To that woman listening to me, or to that even man, to that person listening to us, speaking up, asking for help is so courageous that it also reflects that you know your limitation. Is wisdom, it is humility to know that I'm human after all. I am not God. I am human, and humans have limitation. And guess what? I know my limitation. And so, because I know my limitation, I'm asking for help. And that is one of, I always respect even patients, even clients when they come for coaching or strategy call. I'm like, just knowing that you need help, I'm already on your side. Just knowing that like I need tools, I need help, you have won me already. Because it just shows there's a humility that you're showing yourself. There's grace that you're showing yourself. And of course, doctors, we're so compassionate that we also forget to be compassionate towards ourselves. I mean, if a patient says this, you're like, it's okay. But when you're about to say, you don't even realize that we're so critical of ourselves, and we're so compassionate, empathetic with other people, with patience, that we don't show ourselves. So I love that you showed yourself that grace, and you spoke up, and you asked even your mom to come help at that critical time when you knew you were going to be stretched. And again, I mean, that's another conversation I can get into, how leaders, I think I'm going to have one of my friends come touch on this topic soon, how leaders forget themselves. They serve and keep serving and keep pouring, but they forget to pour into themselves. So thank you so much. That's very profound. So there's while we are here, one of the gaps, we both are from Nigeria, where unfortunately postpartum depression is just, you are just told to you just had your baby, just keep it like, what's wrong with you? Just continue. Shouldn't you be happy? You just had a baby. Why are you complaining? Why are you sad? Unfortunately, there is not enough awareness, and we know that postpartum depression affects at least 1 in 7 women. 1 in 7 women would have postpartum depression. And in America, unfortunately, about 20%, so at least that is 1 in 4 of maternal deaths, is secondary to a maternal mental health issue, such as postpartum depression, is due to suicide. Rather, 20% is due to suicide in this population. So let's talk about it, Adeola. What is your observation? You've already done it. You did that at the summit. What was your take home? What would you tell somebody listening to us that has the symptoms? So what should they look out for? What are the symptoms? I know you're not yet a psychiatrist. Even though I'm speaking it forth, I'm calling it forth that who knows, if your heart desires and if it's the will of God, it will be great, because we need more mental health professionals in this space because of the global crisis, the global access crisis. So, but let's talk about it in your observation, or perhaps even your psychiatric clerkship. What have you observed? Even the summit you did and the foundation. What should that what should that woman listening to us, or her husband, or our community, what should they be seeing? What should they look out for to be like, there's something going on when it comes to postpartum depression? You already did the baby blues summit. What may be the difference, and what should they look out for?
Even to start with, let me just take a little step back. Having That was my very first summit. Like I said, I was inexperienced. I just like, okay, something needs to be ventilated here. And then to see over 250 people register for a program like that, it tells us something. It speaks
Yes.
volume, right? It
Yes.
shows that there was something that we needed, something we're not addressing. And the
Correct.
thing was beyond baby blues. Yeah, beyond baby blues, because baby blues, it has a pathway. There's a succession to that. So the baby blues, you feel, lack of energy. What you normally love to do, you don't want to do that. You're lacking sleep. Passion is gone. And then, like I said, it's a pathway, right? So the blues is very kind of minute. But what we should understand is that it does not start after birth. It's an intrapartum process, even
Correct.
from prior to pregnancy. Every stress that you've gone through during pregnancies or prior of your lifestyle all come together and the hormone just pushes it out, you know. So
That's
there's
it.
something sitting right there, right? So I will not tell people to wait until they give birth before they should start looking for those signs and symptoms, right?
Okay.
So while you're planning of, you feel okay from the day of conception, start looking out for, and even throughout, so that it helps you to manage it. So you're lacking sleep. So it goes from that, lack of energy, loss of appetite, even headache. You're not just yourself. You just don't want to, you're not on that level of where you're normally, you're supposed to be. Your capacity, your involvement in things are not where it's supposed to be. And then it goes to the depression, postpartum
Mhm,
depression.
mhm,
From there, it goes into psychosis,
mhm,
from psychosis, suicidal, and from there, death. It's you just have to like look out for those warning red signs that I just previously mentioned. Some is very subtle. To some, it's just like some will just like consider throwing their babies into the river. We've
mhm,
seen that happen.
mhm,
Prior to the
mhm.
summits, friends were sending me those videos. Oh, Diola, you're doing a program on this. Have you seen this video? And I was like, really? Is this that bad?
Yes.
You know, it's that
Yes.
terrible, and
Yes.
things like that. And even in the midst of it, the word itself, and this is an advocacy for people who doesn't want to associate themselves with anything mental health related disorders. Once you hear the word postpartum depression, the word itself is very derogatory. In
Mm.
Nigeria, we call it abisinwe. You know,
Mm.
nobody wants to come closer to such a name, and so that stigma kind
Mm.
of pushes that. So when a friend told me it was Abisa, I said, "What? Who is going to recognize with such a thing, right?"
Mhm,
But please,
mhm,
that's not what that person needs at that moment. That person needs your presence, your support,
mhm. Correct.
right? Because see, what affects one part of human being will affect it's a family system, and if
Yeah.
the family is affected, the society is affected too, right? So
Correct.
um we should just be open, you know, open to that kind of conversation and normalize it, actually. No,
Wonderful. That's I'm glad. I'm glad. I love what you touched on the name, which may be the one of the reasons for stigma, but anything mental health still has to do with stigma, even globally. But in Nigeria is even, is worse. I mean, there's still some stigma here in America, but in Nigeria is worse. Having been exposed to the two countries, yeah. And I like what you said about the some of this the local names, dialects like Yoruba where we're from, the name. You're just like, I don't want to even want to be associated. Yeah, I don't want to be associated with this. But beyond that, either we before we change the name, we need to focus on the support that is needed. And I like what you emphasized on just being open. What does the person need? And like I said, you're not you're working towards, you're going to be a doctor soon, and who knows? But definitely, you've highlighted great signs to look out for, important signs to look out for, is the mom, like you said, baby blues is usually the first 2 weeks. That's it. You're crying, like you said, the person is crying, the person is sad. Those that can happen. Mood swings, I don't even know how I'm feeling. You may not even be able to articulate the way you feel, but you're crying 1 minute, maybe sad or laugh or do other things. You're happy to be a mom 1 minute, you don't want to be a mom the next, and that can happen, and that's fine. So that's fine. Just understand. Blame it. I always tell my patient, blame it on the hormones, not you. Hormones. Your hormones are the ones responsible, and they have a name. Hormones. Blame them. Why are you like this? Hormones. So let's blame, because sometimes we don't want to take that responsibility. And so hormonal changes, I can tell you right now, they are the ones solely, mostly responsible. In some cases, societal expectations, like we said. So beyond 2 weeks, like you said, then we start seeing the other criteria for depression, because they must meet criteria. And sometimes it's not all the way. Maybe they're already on their way. You mentioned headaches. There's some headaches that come with nursing, not sleeping. I tell people the first prescription I try to give postpartum women is sleep. If you can find someone, sleep. Just sleep. When you have slept very well, come back and let's talk. Were you saying what you were saying before? Because sleep deprivation is one thing we really need to talk about for mothers, to advocate for new mothers, for mothers. Sleep is very critical, because the body needs to rest. The body is doing a lot mentally, physically, in all, all spheres. That mother needs to rest. So what that mother will need is a community of support, is a family of support, is someone like Adeola said, someone that listens. This is the way I feel. Not trying to shun her. You're a mom now. Shouldn't you prioritize? Shouldn't you what? Is it not the mother that is alive that can be a mother to other children?
Absolutely.
Is an emotionally healthy mother that can have an emotionally stable child. And if you're listening to us, just know that, because you can't give what you don't have. So if you're not stable, you're actually passing stress. It's been shown. Stress appears in breast milk. Ding, ding, ding. Stress reflects in everything, in the way you react with the kids, in whatnot. So at times we raise anxious children just because that mother is not rested, just because that mother is stressed. So it's not just a short-term benefit or consequence, it's a long term, because now it's going to affect the children she raises. So just keep that in mind, that the best gift to a mom is the gift of support, the gift of presence, the gift of listening, the gift of being there. So thank you so much for that, Adeola. So now that we're still in the topic of postpartum, tell us a little bit about Thrive.
Oh, Dr. Tiwa. So,
I'm curious.
all
Yes,
right. Honestly, we try. I wouldn't want to go too deep to it because I
that's
think
fine. That's
there's
fine.
more
Yeah.
section for that
Yes.
because
Yes.
we're
Yes.
team, right? So,
Yes. 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 Yes.
right.
Yes. Yes.
But honestly, it was something that was built from this summit that happened, right?
Okay.
Because when I had that summit in 2023, I just knew that that was not the end of it, right?
Correct.
I
Okay.
could it was just too obvious that we needed to take one step further. And
Okay.
then with that, I knew I always believe in the power of partnership,
That's
right?
good.
So strategically, I looked into again, looking into your circle and say, let's come together. And coincidentally, I was lucky to find people who were also passionate about it, and that's how we came about Thrive itself. So, but I believe in your next edition, we'll
Yes, yes, yes,
go
yes, yes,
deeper
yes. I'm looking forward
into
to it. I
Thrive.
I definitely want to hear it, because I like what you said. Partnership. I mean, and we need to start highlighting that. So maybe the July, who knows, but thank you for whetting our appetite so that
Yes,
we're looking forward to it. I definitely want to hear about it, of the power of teamwork, the power of partnership, and the power of networking, and
yes.
what can come from there, because we're not meant to do life alone. So I definitely want to hear about it in our future session, to also meet your team and what inspired them. So based on what you know already, um with medicine, you know, what have you observed in your 16 years, as a nurse, in other facets where you've sat in, listening? We've spoken about the needs of a mom. What have you noticed as what would be the needs? What is the gap that you're picking up on in healthcare, or even why medicine? I mean, you could have stopped. Why medicine? Why did you be like, I want to go to medical school? What inspired you, and what's so I think there are two questions I'm asking in one. So
Yeah,
maybe
right.
let's talk about what inspired you to then want to go into medicine. And then number two, what have you noticed across, because again, medicine is still within healthcare. What are you noticing? What is becoming the patterns so far?
Okay, so why medicine? Honestly, it was a vision that I've kept since I started nursing. I went to nursing school when I was 19. I trained in University College Hospital Ibadan, UCH Ibadan, right? So, and then if I'd not, so I started when I was 19, but admission to be in post-secondary, to have a post-secondary education or like to go to university started when I was, 17. Yeah, all this things started. So for 2 years, I was at home, right, trying to get admission, jam, and all that. And I was just pursuing medicine. But that was my alternative to going to nursing school,
Okay.
right, which was a very great decision that I also made that time. But here is the thing. So 19 years ago, and this year I'm going to be 40.
Mm.
So 21 years, I'm still like, my eyes were still on the goal,
Okay.
right? So when it was time to like revisit my passion, right, I didn't let age be
Mm.
a barrier because at that time I was already like 35,
Okay.
so 1935, you look at that. So but I wasn't going to say, and that time I already had my kids too, and they were still very, very young too. So
Okay.
again, I brought in my husband, very supportive and all that. So it was something I'd always wanted. But I also appreciate how God made all those pathways to come together. That I
Correct.
have to go through nursing, great profession that prepared me to be a better physician I will be. Right.
Mm.
So,
That's good. That's good.
right. So that's one part why medicine. And then the other question is, what have I observed in my 16 years in healthcare? You see, in healthcare generally, irrespective of your capacity, what I've noticed is that we focus too much on patient outcome,
Mm.
right? But we don't look at we focus on the mission and vision of the
Mm.
institution, the
Mhm.
strategic planning, the quality improvement initiative that needs to be done, the global innovative stuff.
Mhm.
But we leave behind the important set of people. And do you know who they are? The drivers of those initiatives, the healthcare workers themselves.
Correct.
We leave them behind. We don't care about, well, don't let me use the word we don't care, but it's not as how we focus on, you know,
Thank you.
the outcome itself, right?
Thank
So
you.
we leave that behind. And over time, we are caught up with compassionate syndrome,
Mhm.
because if you dare speak out that this is where you're feeling, people will think you're less of a physician or less of a
Mm.
good nurse or less of a good healthcare provider. That didn't you know that? It comes with autism, it comes with
Mhm.
compassion, it comes
Mhm.
with this, it comes with that. So if you ever spoke out, it's like, are you sure you're supposed to be here?
Mhm.
But giving people the opportunity to ventilate and not just listening, but to do something about it, because burnout is a big deal, and it's increasingly, rising even more than we think,
Yes.
right? So, and we see a lot of people quitting. People are leaving healthcare, some people are leaving, or people are even leaving earlier. We've
Yeah.
seen, though I don't want to focus on the negative side, but
Yeah.
you see
Yeah.
some physicians doing residency,
Yeah.
burnout, they're not being supported, so there's this expectation that you have to be this, you have to be that, and if you ever decide to say this is the way I feel, then it's like you've committed medical blunder for
Oh,
something
yeah.
else.
Yeah. Yeah. Like, how dare
Right.
you? Yes.
How can you say that? Like,
Yes.
this is what comes with the job. But yes, the job itself might be stressful, might be demanding, but it's very fulfilling. There is no doubt. However, I think leaders in healthcare and even co-workers, contemporaries, we need to look out for one another
Correct.
and create that avenue that is conducive for people to ventilate how they feel.
That is wonderful, and thank you for naming that so well. You said it. I mean, that's one of the drivers. That's one of my mission. I mean, for me, just seeing it just breaks my heart when I hear of another physician suicide.
Hmm,
So about 400 physician suicide per year.
that's a
That's a
lot.
whole class. So a whole class is wiped out a year. I mean, how many doctors are there? So then you now have 400 gone every year. I mean, medicine has the highest number of profession related suicide. Oh yeah. Oh yeah. Doctors hold that record. And so it's a big deal. But before suicide, I've been part of committees, there are movies of do no harm, a lot of discussions about it. And we if we're going to stop that, we shouldn't wait until burnout happens.
Mm-hmm.
which is why I'm so big on prevention. America is very focused on a sick system instead of a well system. But since I cannot change the whole of the medicine in America, at least I can start somewhere where for the healthcare workers, organization development, professional development. Do we have to wait until the doctor is depressed? Do we have to wait until the doctor now has lost all empathy and just disconnected? Do we have to wait? And that's usually what happens, like you said. The doctor says I'm leaving, and then you start having, what could we have done? How can we make this better? How can you make you stay? Like, seriously, I've been here for 10 years. You never asked me. Do you know my name? Do you know my first name or just my last name? Do you know what I like?
You're
Do
just
you
a
even know? You don't even notice me. But now today, I'm saying I'm leaving, and suddenly, can we increase your salary? What can we do to make it better? And I feel like it's too late. And like you
Mm.
said, the drivers, there's a saying that I love to say, which who knows where I picked it up, is that, I must have picked up somewhere where, when you take care of doctors or your workers, seriously, the ones that are very sensible, and most doctors are, they will take care of what you want them to do. It just makes sense. You take care. Okay, how high do you want me to jump? As compared to you keep demanding, you keep, like you said, patient outcomes, quality, safety, improvement, global. You have all these measures, but we don't have metrics for our doctors. That's really what even inspired me for the physician capacity. I have this capacity profile check that I have it on the website where I just check, just come check your capacity profile, just because we don't, who is taking care of us?
Absolutely.
Yeah, who's taking
Let
care of
me just
us?
even
So
chip in something there. And that's why I love, where I did my basic sciences, there's some set of alumni physicians. They already put in money aside for students to be fed, medical students to be fed for lunch. Yes, we
wow.
like it might look as if it's food, but you and I know when you were in medical school, if you have not eaten well, tell me how those pathophysiologies are going to sink.
That is
Professor will be
so
saying one
good.
side, it will just be
You
like
got, that's it.
the
That's
other.
it.
So if sometimes where we didn't even come to school with breakfast, we know that lunch, oh Lord, Monday to Friday, and
That's
they've been doing that
great.
for years.
That
And
is great.
where I'm currently, the hospital where I'm currently doing my surgical rotation, during lunchtime, they feed their physician and their medical students.
That's
And I'm like,
great.
what? Free.
Great.
I
Great.
might be using food as an
Yes. Yes.
example,
Yes.
but
Yes.
that is the basic. That's where you start from.
Yes. No. Yes.
You don't have to
Yeah.
worry about all that. And then, this is not to say to feed the whole hospital, but they know that the demand of the work itself, at lunchtime, it's just to show that we see you, we hear you, we feel you.
Correct.
That's the little
Yes.
one of the
And we
things.
appreciate you. We
Absolutely.
appreciate you because that's one of the things that I see lacking. Um, when I've spoken to several doctors, is the I don't feel valued. I
Mm,
hear that a lot from so many doctors. People just they keep asking of me, and I'm in the system. So, where I work, I also see physicians. And so I hear that and I see that in some systems where, it's just like we just see doctors for as money makers. That's it. Just how many patients have you seen today? You have not seen enough. You need to see more. But we don't see that person for who they are. And that's the critical thing that, that's why I advocate for that, where, even not just for physicians, like you were saying, residents, burnout doesn't start when you practice. In fact, it starts with medical school, as you're saying. So a lot of us actually have, what I'm noticing is we've been carrying the seeds of burnout from
yeah.
medical school. We're competing.
Mhm.
I didn't sleep. I only got 2 hours. We've been competing with, is the survival of the fittest. Even though you're in medical school, you're still surviving. You're still trying to fight, and you're not sleeping. You're not eating, like you said. Sometimes you're not even going to the bathroom to get a
Mhm.
break. And so again, we are learning to help others while forgetting ourselves. It's
Right.
so very interesting that,
Mm-hmm.
and we call it training, we call it education. Even if you're saying you're going to eat, even some of the professors or some of the doctors will tell you, eat. How? Have I eaten? Why should you eat? So there's abuse in medical system. There is discrimination. There's already there. It's almost like you're struggling in this environment that is raising healers, and you are wondering, what kind of healer are we raising?
Yeah.
How are they going to heal people when they're not even nurturing themselves? And that's why, one of the things I do is protecting our capacity, ourselves, because is the stable doctor that
Mm-hmm.
can be exceptional, is the
Absolutely.
rested doctor that can show up. If you have not slept, I won't even let you touch me, because you just be
Medical
malfunctioning, and
error.
you don't want that.
Yeah.
And I wish more patients would ask their doctors, I hope you're sleeping well. Are you sleeping? Are you taking care of yourself? I wish more patients would ask their doctor, how are you doing? I mean, the doctor may likely say, I'm fine. But
Mm-hmm.
it's the same thing for mothers. Who is asking the mothers, how are you doing? Is that child asking? Is the husband asking? Or is just keep pouring? Or can you be like, hey, spend some time? If it's 5 minutes, if it's 10, whatever you need, your me time, do whatever would help you fill that cup, even though you're going to empty the cup soon again. But we need to do more work. So I love what you shared about even the alumni. That's impressive.
Mm-hmm.
I'll save that somewhere, but that's very impressive where you feed the medical students already, that may not be thinking very well, that is already under pressure. And we start there. So we really need to change the narrative with the medical students if we're going to even change that narrative as a doctor. So tell us a little bit about your work. And I know we're almost run out of time. Tell us about your work with autism, ASD, spectrum disorder, because I know we've done some work together. And thank you, by the way, for
You're
that
welcome.
opportunity to collaborate, to talk about it, comparing how ASD is done here and don't manage, and comparing that with Africa, where we don't have resources. Tell us a little bit about that. And who knows, we may have other people that are working in that space that may want to collaborate with you going forward. Tell us about it.
Yeah, so with the autism spectrum disorder, it was what I focused on for my second master's in international public health. That was not my goal when I was going into that program. My goal was to go address maternal health related issues. But back in Canada, um, a therapist had approached me and she said, Adeola, what is wrong with Nigerian children? Or what is wrong with the Nigerian government? I said, what do you mean by that? She said, more than 99% of our caseload are Nigerian children. We came to Canada in the last 5 years and getting the diagnosis of autism for the first time in the last 5 years, a caseload of over 99% of 90%, and they are Nigerian children, and they've never been diagnosed. And in the last 5 years, when she looked at all the statistics, so I think it makes sense for her to ask, what is wrong with us? And all that. And I was like, honestly, I didn't have an answer to that because it came unexpectedly. So I decided to kind of like, okay, my dissertation is going to focus on autism spectrum disorder.
Mm,
So I went deeper, and even during the course of the research process, there were limited data out there because, again, a lot of people, the same set of researcher are the ones still doing it. There
correct.
is same set of people, and I heard recently that last year that even the big person after research of autism in Nigeria had passed away, Dr. Bakare.
Mm,
So I hope other people can pick it up, and because if you are researching about autism in Nigeria, if you have not read Dr. Bakare's paper, then you've not really done deep research. You
mm,
went so deep into that and all that. And so doing that kind of research opened my eyes to the importance of awareness, importance of early intervention, and how we have the country itself, or even Africa generally, because don't forget, it falls under mental health again. Mental
correct.
health, right?
Correct.
And we don't want
Umbrella.
You know that we have that hey, no. Is either we hide those things, we don't want to talk about it, right?
Mm.
So doing that helped me with a lot of doing awareness,
Okay.
putting out that information out there, letting parents know that with early intervention, you know, things can begin to be better, right? And then, just letting that person be who they are, right? Neurotypical versus neurodivergence, looking at all that. Let them be, right? People are unique in their ways. They're not different. They are
Mhm.
just who they are, and let them give them the thriving environment where they can actually become who they are. But what I also observe, and this is again, advocacy will keep coming.
Mhm. Mhm.
This is it. Whoever who is listening, who has decided to say that autism spectrum disorder intervention is where they want to dive into, please make sure you have the passion for it. We've seen a lot of people go into this program or intervention. They're not supposed to be, around it at all. They just want to exploit the parents
Yes.
because they know that is what is in vogue now. The number keep rising, and a lot of people, parents are, kind of like stressed. And as a mom or even parents
Excuse me.
generally, you
Excuse
are when it comes to your kids, you want to go any good lengths to do things, whether financially, in anything you can think of to make that child better. A lot of people who have no business in that intervention phase or providing therapy for such family or for such children, we begin to see them influx of such people. They're enriching themselves. So I'm just advocating that please, to have such in the family is emotionally draining to start with. Please do not add to that by exploiting and taking opportunity of that moment or that condition that the child is going through.
Thank you so much. I'm glad. I like the word. I mean, there's several things that stuck with me. Like you were saying that resonated with me about advocacy, and then just being careful. There are some scammers out there that want to take advantage of the awareness. So there's a need to balance that and just make sure are they for real? And it's suddenly it just seemed like, is there more? Because definitely data is showing that there's a higher number, so is it more diagnosis? Do we suddenly have more tools to recognize it? Is it, like you said, early intervention that is picking people more? But the incidence has gone up globally. And in Nigeria, definitely, we're picking up more. In Africa, yes, but it also is also sad where in Africa you don't have as many resources. The ABA that is here, you don't have it. That people still don't understand. Here it's getting better. With ABA, thank God for them, but also there are also additional resources. Some people have heard, it's beyond the ABA, they tried other things too. So there are additional resources. People are looking into it. And there's even some doctors that this is their specialty, this is their area of interest. So it's good that while we're getting resources here, but in Africa, that's why your work is really important to continue to raise that awareness, um, because there's still that gap in
Yes.
Africa. There's still that gap. People still don't understand it. While there's uniqueness, I always say to everyone, every disability is really a chance to be unique. Is a uniqueness. Is it makes that child unique. And how do we provide an environment where that child can blossom, where that child can be him or herself, where they can just be, and while learning to increase capacity, for sure we want them to grow, we want them to learn skills, but how can they learn it in a very safe environment, in a very loving environment, not a harsh environment? So I'm glad you mentioned that. So as we wrap up, I'm just checking. So my apologies for the sound. I was checking YouTube if there were any questions, but I don't see any question. Yeah, so they may come later, but and I know we didn't even get to talk about substance abuse. Um, we didn't even talk about substance abuse, and but it seemed like we still have to bring you back later at some point. Yeah, because you've done a lot of work, in this space that you should be very proud of.
Thank you.
And that's why I said, who knows? Maybe those are signs that you're going to join us in mental health field as one of the professionals. You've contributed. Substance abuse is rising, and maybe I should just pick 1 minute. What was your observation? Because that's what I'm also hearing in Nigeria. Substance abuse is actually rising now, and we have substance abuse disorders here. For a while, there was the opioid use disorder epidemic. There was that unintentional overdose. Just it's getting better now. So stats are showing that there's a decrease in the opioid overdose, which is great.
Hmm.
So definitely things are improving. But in Nigeria, it just seems like substance use disorder or substance use is rising. And so, based on your work, when you went to Ibadan, what did you observe? And I don't know if you have any comparison here. As a medical student, I don't know of how much of exposure you've had during your psychiatry clerkship.
Yeah, so with Nigeria, like I said, I'm a person of focus. There has to be a demand before I go into, intervene. So if you look at the statistic that was released by the National Drug Law Enforcement Agency for Nigeria, um, every year we lose over 2.5 million people to substance abuse. In that, we lose that to that, right? And that's very sad, actually. And then, about 14 million Nigerians are on drugs, which about 40% of our population of young adults are on drugs as well. Those numbers are not, if you look at the national, no, sorry, the global percentage of that, Nigeria seems to be on the high side with it. So that is not something we should, it's something that demands immediate intervention. And what I noticed is that the key speaker that came to, that you spoke about at the event, that spoke at the event, Dr. Farumbi, very well successful physician, the kids were asking intelligent questions, and those questions were like, what? The contents of the question was showing that is either these kids have been, the substance itself is close by. Maybe they
Hmm.
are not doing it, but they can see somebody who is close by doing it. So the
They've been
caliber
exposed. Hmm.
exposed. So maybe them are not doing it right, because we had school children, both from higher institution. Uh, what's it called? Junior and senior secondary school. And we make sure we brought in private and public together, for that event. And we had over 150 children, for that program. And you could see the caliber of questions they were asking. It was, and I love the fact that the student were asking questions, but it was an intelligent question that is way beyond that age,
Wow.
right? So it was like, there's work to be done. And then we also moved to the community level as well. We didn't stop at the school. We went to attend to 120 community members, and we're very strategic about the community we use. We use a place called Idikon in Ibadan, which the numbers also show that there's an issue there as well. So what we see is that the younger population are looking up to the older population who are already exposed, and they thought it
Mhm.
was normal. So yeah, let's do it. And that's how we feel cool about ourselves,
Mhm.
makes us high
Mhm.
and stuff like that. But and that's to tell us mentorship is good, but be careful who you look up to, right? Be very very
Right.
careful, right? Because mentorship could go south, and
Right.
it could affect the population generally. So I'm glad with that program we're able to attend to close to 300 people in total, for that, which I'm sure the organization will be very proud of us doing that for Nigeria.
That's good. I mean, I think that speaks a lot about you, where your heart, your heart for people, your passion to help people. It's, I mean, we can't solve every problem in the world, but how can we focus on the ones that we can, the ones we have capacity for? For those that don't know or not familiar with Nigeria, Ibadan is the capital to Oyo State. It's one of the states in the southwestern region of Nigeria, and it's a big state. It's it's one of the large states, population wise. So I'm glad you were able to at least impact those 300, excuse me, children. Hopefully those 300 children also impacting lives, because that's what, like you said, that's what we need. Hopefully they can be, the cycle can break and they can be better mentors to the next generation. Because, like you said, we really need to be careful, with mentorship, with who we listen to. While we claim support, we want support. Is that the right support? There's the bad support too that can really be detrimental long term. So it's good to really assess, to really ask questions, to discern, is this contributing to what I need, or is this going to hurt me long term? So it's, I mean, we've had a robust conversation, and as we bring it home to that woman, with everything you've shared, what would you say? What do you wish someone had told you earlier about the cost of constantly being on for everybody else and the practice of actually protecting your own mental peace? I know you touched a little bit on that, but as we bring it home and wrap up, to that woman listening to us now, that most women, it just feels like most women that I know, they wear multiple hats. I don't know. Yeah, maybe a very few that don't wear multiple hats.
And those ones that
You
doesn't
know,
work, they're like deviants, right?
I think they're just choosing exactly. Maybe, yeah, maybe they're
Society sees them
defiant where they're
as
just
deviants.
like, you know what? I just refuse. I just refuse to be like maybe my mom or be like my sister or be like, yeah. It just seemed like um, an average woman is, I call it restless in a good way. An average woman is impacting, contributing, if she can see it that way. A future forward, I think is a dedicate that says that that woman is contributing because of just who we are. As a person of faith, you can be like every woman with a womb, nurture something. Just having that womb, you have to nurture something. You have to produce something, like you said.
Yeah.
Maternal is production, productivity. And what are you producing? You can be positive, you can be negative. So, for you, looking back, what would you wish someone had told you to have maybe prepared you better, that you can share now as we bring it home? Yeah, to that woman.
Well, to the woman listening, the world will always be in need for so many things, right? But one thing for sure is that exhaustion is not a badge of honor,
Mm.
right? You don't have to hand rest. You don't have to hand, taking a break. Look at where you are, be truthful to yourself, right? And take a rest when it's needed. You don't have to be told. Nobody's going to, the world is not going to stop by saying, we're going to give you an award for being the most um, exhausted human being in the world. There's no award of
Mm.
such. So if you peradventure you're working towards such an award, nothing of such exists. So take it one step at a time. Know where your limits are. It's just the principle of physics, the principle of elasticity. You stretch and stretch and stretch. A point is called the elastic limit. You break, boom. And those roles you think you want to, those multiple hats, you might not be able to, perform to that capacity that is expected. So please, you don't have to earn it. If you think you need it, take it. It's you. And it's just one life, period.
Wow. Thank you. Thank you, Adeola, for giving us the permission to rest. Thank you for giving us the permission to not wait to get the permission. Thank you for setting us free, because that's what you just did. To that woman, to even the physicians, even the medical student, even the resident, is that you don't need permission to rest. Rest is part of recovery, and we need to do more of that. Anybody that wants to live long in this life needs to prioritize rest. While you're working, rest is part of productivity. That's the way I define rest. So, rest is not just sleep, rest is not just eating food, it's part of it. Rest is anything that replenishes you so that you can continue to do more of what is productive. So
Absolutely.
rest is part of purpose. It's part of your recovery strategy. So anybody that wants to go far must prioritize rest as a recovery strategy in order to go far. So I love what you said. Let's see. I think you've covered everything that I could think of. Where, as we wrap up, where can we find you? So they want to connect with you about maternal programs, family programs, mental health programs. To continue this conversation, where can they find you? How can they connect with you?
So yes, I'm on LinkedIn as Adeola Folorunso. So the Folorunso without H. Okay. so so I'm on LinkedIn like that. Matamenta is also on LinkedIn. Same thing with my Facebook page as well. And I do have an email address called matamental23 at gmail.com. So matamental23 at gmail.com. I'm available to, participate in conversations that will impact life
That's
overall.
good. That's good.
Yeah.
I saw the way you paused. Like before I commit, and
Yeah,
it's good.
exactly.
And it's good. I love it. I love when you're like, hmm, am I stretching myself? And the power of pause. That's another strategy. Like pause before
Before
you
you
you're
commit.
about to commit to yourself, and somebody's like, "But I heard you on top of
Yeah,
Dr.
like
Tiwa's show, and you said you were available." So yeah, and some people don't know the meaning of setting boundaries, and so I love where you paused, where you're like, "Okay, I'm available to speak." What degree or what dimension, to what extent, that's secondary, because Adeola is about wrapping up in medical school, and medical school is a full-time job on its own and combining with many things. So well done. And we look forward to celebrating with you when you finally, you add your MD to all the degrees that we already see. So we're glad you were able to join us. And to you out there, we hope you've learned at least one valuable tool. Maybe you've been able to learn. Maybe you're relearning, and maybe you're unlearning. But we hope that you've been able to take at least one valuable tool from this conversation. As a woman, take care of yourself. Nobody else is coming to do it. Prioritize you the same way you prioritize everybody else. Remember, you cannot pour from an empty cup. You need to know that as a spiritual person, as a professional, whatever your status is, it's when you are alive and well that you can fulfill purpose. You can be a mother, you can be a wife, you can be anything. But remember, it's only when you're able bodied, is when you're able to do it. So thank you for joining us today. Watch your capacity, assess your capacity, nurture your capacity, protect your capacity. As always, being your host, it's been wonderful, Dr. Tiwa Oshinfison. I look forward to seeing you in the future series. Bye for now. Bye.